Welcome to Facial Plastics Friday, everybody. It's Dr. Brace here. Last week I talked about the preoperative experience for rhinoplasty. Today we're going to talk about the postoperative experience. So the first thing to know is that when you wake up from a rhinoplasty, it's usually done externally. So there's a little incision here and there's a cast on your nose. The other thing that you need to be aware of is that there will be gauze up each nostril and a gauze taped to your lip. We call the lip gauze a mustache dressing because it looks like a mustache. And then the gauze that are in your nose, they're telfa, so they're plastic coated gauze, they're non-stick, and they provide gentle pressure overnight. So the morning after surgery, you can pull the gauzes out of your nose and you start rinsing with saline. And then at day 6, we bring you here to the office. So I'm in the procedure room now. If on day 6 you have a lot of bruising around your eyes from osteotomies or broken bones that we've made, then we use the pulse dye laser, which is in the corner here. It's turned off right now, but we'll use that to help treat the bruises so that they fade away quicker. And then you'll see Jocelyn. And Jocelyn's our nurse who we introduced a few times on Instagram, but last week as well. She's in here today.
Hi.
And Jocelyn will get your cast off and your sutures out. And so let me show you what the postoperative equipment looks like. The sutures that I use are 6-0 proline. So they are tiny, 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 little tiny hair-like stitches. And they're right here under the tip of your nose. And so to get those out, to make it as comfortable as possible, we use a tiny little forceps to grab the edge of the stitch. And then we use these little blue scissors here. Now these are special scissors because the tips are rounded and so they don't pinch the skin. And I can actually put this anywhere on my body and cut, and it won't cut skin. And so this means that we can push it onto the nose here and cut. It will cut the stitch, but it won't pinch your skin and won't hurt you. So it makes it as comfortable as possible. Once the stitches are out, we take off the splint. And I use adhesive remover on basically a big Q-tip. So these are just cotton tip applicators. And well, I say I do it, but Jocelyn does it now. So we soak the tip of the Q-tip in the adhesive remover. This then goes down underneath the splint. So very gently come down underneath the splint along the nose here to remove the adhesive, and then the splint pops off. So it's not a very painful experience. There's a little bit of pressure, but it's pretty well tolerated. Once the splint comes off, the next most important equipment is the mirror. And so the mirror will help you look at your nose, obviously. And then I'll check the inside of your nose with a little tiny speculum, make sure that your septum's healing okay. So that's the experience after a rhinoplasty. I'm going to show somebody having their splint removed, which happened today. She was a rhinoplasty from last week, and you can see kind of what that looks like. And after the splint comes off and the stitches are out and you've had a look at your nose, the follow-up after that is then 1 month, 3 months, 6 months, and a year. And anytime in between if you have a worry. Sometimes around the 3 to 6 month mark, I'll inject the nose with a steroid solution to help bring down the swelling if it's not coming down on its own. Sometimes we have to do prolonged taping, but for most people, once the cast is off, once the stitches are out, it's just a matter of time. It takes about 3 months for the swelling up here to go down, 6 months for the swelling in the middle of the nose to go down, and up to a year for the swelling on the tip to go down. So if you're thinking about a rhinoplasty and you're trying to plan it, those are the time frames to keep in mind. I hope that was helpful. We'll see everybody next week. Bye-bye.